That we've had a positive case of COVID in our community. That person went into the Townsville hospital last night and tested positive. Today the Queensland Health have put out a number of conditions around level 2 restrictions, which will mean from 4 o'clock today we will need to be wearing masks when we're out in the open. There are a number of other restrictions as well for businesses, weddings, funerals, a whole range of things. So I urge people to have a look at the Queensland Health website. For us here in Townsville, it means I want to encourage the community to get out and get tested. The sooner we can prove to Queensland Health that COVID isn't embedded in this community, the sooner we can get back to a more normal existence, and maybe, just maybe, we're still in the running for the NRL Grand Final. Now, the testing facilities will be at 1300 Smiles Stadium. It's currently open. From 1 p.m. today, you will be able to access 3 lanes at Reid Park. Tomorrow, we will also be opening up James Cook University for testing. There is no reason not to get tested, especially if you have symptoms or you may be at the exposure sites or may have been at one of the COVID sites. So that's what I want to urge the community. The other thing I want to do with our community is, if we don't want to continually to be in this space where we've got restrictions, we haven't got restrictions, things are happening, things aren't happening, get vaccinated. I cannot urge the community to ignore some of the rubbish they're seeing on social media. Ignore the chefs, the wags and the politicians who wear mankinis. These people are not credible. The medical profession is credible. Vaccinations work. The gentleman who tested positive was vaccinated, which is why we're very hopeful we won't see COVID seeded in Queensland, in Townsville.
Mayor Hill, we're already hearing reports that people are panicking in our community. What message would you like to send?
You don't need to panic, all right? We can control this. We can control this through testing and vaccination, and that's what the governments want to do. Look, it's a bit like the flu. You get vaccinated, some people still get mild disease, as this person did. Others don't show any disease at all. But it's the risk to the people who aren't vaccinated, and we're seeing that in Victoria and New South Wales. There you've got ramping of ambulances for up to 7 hours, insufficient beds for those people who have COVID. It's a massive drain on our health system, and that's why everyone in Queensland is saying get vaccinated.
Last time we had a positive case in the community, we went into lockdown immediately. What is different this time?
I think this time this person was vaccinated, fully vaccinated, and really was asymptomatic even on their presentation at the hospital. So I'm hopeful that if we can get a vast majority of people who could be at risk tested, we can have some confidence here that we're not going to see particularly the Delta strain of COVID embedded in our city. And that's really what we want to do. But the best way to ensure that's not going to happen is to get the community vaccinated. Now, from the numbers we're seeing, people under 40 aren't showing up for vaccination as much as the older cohort. Can I say that you just have to have a look at those people who are sick, under 40, sick with COVID. Your average stay in ICU is 5 weeks, and many of those people, when they leave, still have some severe health problems, particularly lung problems. If you don't want to end up like that, get vaccinated. That's the easiest way to ensure you will be okay.
Last time we had a COVID case in Townsville, we went into a 3-day lockdown. Are you concerned that will happen again this time?
It could happen, especially if we don't follow the rules that are coming into place at 4 o'clock, and also if we don't go out and get tested to show Queensland Health, to show the CHO and the government that COVID isn't embedded in our community.
Was this man tracked down through contact tracing because of his connection to the aviation cluster?
No, he actually had been feeling ill, had hay fever, or thought it was hay fever, and sought to go to hospital, which he did last night. So he has been very responsible throughout this. I believe he's assisting Queensland Health around places where he has visited over the last week. So he has been out and about working in the community over the last 8 days. The issue now is we need Queensland Health to place on the website the places he has visited, so our community can see if or not they may have been at risk.
Do you think that should have happened before the press conference this morning? The Cho stood up and told everyone to go look on the website, but there's no sites there yet.
Well, that's right. I mean, we really need that information out as quickly as possible, and I urge Queensland Health to do that, to get that information out there. I think it would help calm the community to see what's going on, but in the end, we're into 18 months, 19 months of this pandemic. We have the opportunity to stop it dead in its tracks by getting vaccinated, and I can't understand why some people out there seem to take their medical advice from politicians who wear mankinis.
Do you have any insight into how sort of widespread this man may have gone across the city, or the range of locations?
We don't know as yet, though we have been told Queensland Health are working through this at the moment to ensure they are able to put all the areas up that he may have visited here in Townsville. They are saying he's being very cooperative with Queensland Health.
And just to confirm, he's not actually from Townsville?
No, he was sent up from Brisbane to assist as a pilot to assist a local company here.
Is he from Brisbane or is he from somewhere else?
He's been in Brisbane for quite some time. He has flown in from Finland. He complied with all the quarantine measures previously, and he has been in Brisbane for quite some time. So it is believed he's actually linked to that cluster coming out of the aviation industry.
And do you know what part of the aviation industry he's connected to?
I might get the police to advise you on that.
Do you think this ruins our chance of hosting the NRL Grand Final?
I think, look, the Premier has said that the Suncorp Stadium now will be reduced to 75% with these current restrictions, or this level 2 restriction. I still think there's a chance for us if people go out there and get tested, so we can prove to the Chief Health Officer that COVID isn't embedded in the Townsville community. I was just going to say, and the only way we can do that, get tested.
We did just have the rugby championship here on the weekend. Is there any inkling around whether this man may have been at the rugby championship?
Well, that's what we're waiting to confirm with Queensland Health. At this stage, there's no indication of that.
So, Mayor Howell, it's actually safe to say that you believe it may be a low-risk case for everybody?
Oh, look, I mean, the only way we can be sure it's a low-risk case is if everyone gets tested and they come back negative. That's the only way to ensure that it's low risk. But we don't want to take the chance. We want people to get out, and if you have been in some of those areas, once those areas are made known to us by Queensland Health, get tested. If you haven't been vaccinated, get vaccinated. The sooner we hit about 80%, 90%, the sooner borders open up, the sooner that this just becomes a footnote in history.
What are you hearing as far as the current testing sites are concerned?
So 1300's already starting to exhibit a lot of vehicle traffic. I'm encouraging people, if the lines are very long there, to look at going to Reid Park to be tested. And as I said, by tomorrow we'll also open up James Cook University. And can I say I want to thank the private pathologies who are working with us in Queensland Health, the Townsville Health District, to make this all happen.
How much did the planning phase after the last lockdown impact how quickly we were able to respond to this case?
Oh, look, that was a great test of our ability to stand up extra testing sites, and I think it goes to show how we work here as part of disaster management. We do take it seriously. We have good connections into community, particularly the business community, and we're able to call upon people to assist us in times like this. So I don't want people having to wait 7 or 8 hours to get tested because there's only one facility. If people really want the NRL up here, go and get tested. If you want to ensure that we can spend Christmas with our families, get vaccinated.
Amen to that.
It's simple.